Good afternoon, Governor Walz. Thanks for taking the time to talk with bedside nurses. If you don't have bedside nurses on your team already from hospitals and care centers, please think about having us. I would encourage you to do so. We are giving a different perspective than the hospitals are. The hospital currently says that we have 4 to 8 days worth of many supplies that we are currently reusing. Tomorrow I will work with my team to open our next COVID ICU at St. Joe's, and we are currently having to reuse our mask throughout the day, taking it on and off to go into patient rooms, and then having to continue to wear that for 5 additional shifts. I'm worried that the fit will no longer be adequate to protect me from this disease with no cure. We are also reusing gowns. We wear the same gown, we take it off and put it back on again multiple times in a day, something that we would normally throw in the laundry bin after each use. Currently I still have to bring my scrubs home to launder at home, which puts my family at risk. I am happy to care for these patients. My heart is there to go care for these patients that are very, very ill. But I feel very worried about the protections that have been given to me. Please help us get a plan in place to have more PPE available to us so that we can continue to safely care for our patients. Thank you for your time.
Hello, my name is Kristi. I'm a registered nurse at United Hospital. I work in a cardiac critical care step-down unit taking surgical patients currently. And my question is, considering the intimacy of bedside nursing with face-to-face contact and long encounters, and given the fact that registered nurses at United Hospital face disciplinary action if they choose to wear N95s, my question is this. We are currently testing surgical patients for COVID-19 prior to surgery. Shouldn't we be testing all hospital patients? Thank you.
Hi, Governor Walz. My name is Rebekah Kreger. I'm a registered nurse at Mayo Mankato Hospital on 4MS, a medical surgical unit. I am about halfway through my quarantine at home for a confirmed positive exposure at work. A little bit about what's been going on at Mankato Hospital. We do not have designated units any longer for our COVID positive patients. We're blending assignments, so negative and positive patients will be given to one nurse going in and out all day. We have visitors now at our hospital, and we're open up for elective surgery at the same time that we furloughed a bunch of our nurses. So nurses are concerned about how seriously Mayo is taking the protections for our patients and our nurses and our community, quite honestly. So as governor, I guess my question is, will you support Mankato nurses in fighting for patient safety and staff safety? We still don't have our contract we've been working on trying to get going since September, and that still hasn't been ratified. So how will you support Mankato nurses in getting the supplies and the staff and the policies that we need to be protected to take care of people in this pandemic?
Hello, Governor Walz. My name is Amanda Peterson. I'm an ICU nurse in the Twin Cities and have been for nearly 14 years. And I'm currently working in the COVID ICU at United Hospital in St. Paul. I worked during the H1N 1 year, and back then I remember units filled with ventilators and prone patients. And I have a distinct memory of the last words a young girl said to me before we put her on a ventilator. And those are the last words she ever spoke. And now again, we're starting to see this same thing happening. Only this time, the virus is more silent and more contagious. And for the first time, we have to worry about bringing it home with us. As you know, the frontline staff here is fighting and struggling with the lack of correct PPE. Waiting for me as we speak, in a paper bag with my name on it at work, is my N95 respirator mask. This mask, along with others, are being rotated for 5 shifts now. For me, that means 5 12.5-hour shifts or 60+ hours per mask. Those are supposed to be one-time use, single-use patient masks. This is my lifeline. This mask is my lifeline to protect my lungs for bringing this virus home to my family. I have a 4-year-old little boy and a 7-year-old little girl. And my husband, within the last year, had surgery for kidney cancer. These people are everything to me. I am a third-generation nurse, and this is what I was born to do. And I know I'm doing the right thing by helping these people. But by doing so, we're paying a heavy price. And you as governor have the ability to put healthcare policy into place, protect me and nurses like me. We need access to appropriate PPE as available. We need hospital management to hear our concerns and be transparent about what they have and what we can do with what we have. I recognize these are unprecedented times and that you may not have all the answers. But as your frontline workers, having your support and policy in place to protect us would be a step in the right direction. And so I guess my question is, what will you be able to do to give us peace of mind on the front line while we protect those you serve? Thank you for your time.
Good afternoon, Governor Walz. Thank you so much for taking time out of your busy schedule to meet with us. My name is Teresa Koenen. I'm a registered nurse that works for DHS in the Forensic Mental Health Program on the St. Peter campus. I'd like to just take a little time to talk with you in regards to N95 masks. It's my understanding that DHS has about 20,000 N95 masks stockpiled in a warehouse. I am asking that DHS follow CDC and OSHA guidelines. That is, making available all staff caring for patients with suspected or confirmed COVID. I am asking you, Governor Walz, if you would make all DHS leaders make N95 masks available to all staff caring for patients that have COVID or are suspected to have COVID. This would make us feel a lot more at ease knowing that we are doing everything possible to keep ourselves healthy and safe so that when we go home to our families, we are not bringing COVID home to expose them. Thank you very much, Governor Walz, for your time.
Hi, my name is Jolo Battles. I'm an RN at Abbott Northwestern Hospital on a neurology unit that functions as a non-COVID unit. I come to you from my home wearing a mask because I'm concerned about my safety, the safety of my coworkers and patients, and the safety of my family. My hospital utilizes universal masking, but the masks we are given are paper-thin procedural masks that do very little to prevent the spread of COVID-19. I've asked to have testing expanded on our floor given recent findings of an asymptomatic COVID-positive subgroup of patients with new strokes and seizures among an otherwise low-risk population. I was told there are currently no plans to test these patients if they don't present with the typical COVID symptoms. We've also been denied tests for these patients despite having findings of ground glass on chest x-rays, which would otherwise be considered a finding in COVID-positive patients. Also, my hospital does not have a policy to prevent working within COVID and non-COVID units during the same shift. This greatly increases the risk of spreading COVID to others. All the while, 3 nurses on my floor have contracted COVID-19, even though we are a non-COVID unit. One nurse was denied compensation from work for time off to recover because we are not a COVID unit, so it was considered a community-acquired transmission, and he was forced to use his own sick time. We need your help to get N95 masks for everyone and expand testing in the hospital. We need help because as I record this message, I'm concerned my employer will retaliate against me and fire me for voicing my concerns. They have too much money and power for me to fight them alone.
Hello, my name is Sarah Simons, and I'm a registered nurse at Hennepin County Medical Center in Minneapolis. Our employer, HHS, is invoking emergency language for State Statute 181.275 regarding mandatory overtime. Nurses have been at the front of the line in caring for patients since the specter of COVID arrived on the scene, and we remain committed to providing care to our patients. In spite of having weeks of lead time before the surge came to HHS, the hospital is insisting that they have the right to make nurses stay beyond the end of their shift and to work additional shifts beyond their work agreement. We fully recognize that these are unprecedented times, but where is the line between their lack of preparation and what can be reasonably demanded of nurses? Nurses should not be pressured to provide patient care when to do so endangers themselves and their patients. What recourse do you suggest? Thank you.
Hi, Governor. My name is Elizabeth. I'm an RN in St. Paul. I currently work on a unit that is ready and waiting to be our next COVID positive med-surg unit. Currently, an issue that we're having is the fact that our leadership sent out emails to us telling us that for our unit, we would be only required technically to wear a surgical mask and a face shield, that an N95 respirator or greater protection was not needed, was not necessary. We could use it if we wanted it, and we would be provided if we wanted it, but it was not necessary. This is not in accordance with the CDC guidelines, which still state that the N95 is the gold standard for taking care of these patients, any COVID positive patient, and that surgical masks are to be used if N95s are not available. I understand that we've opened up elective surgeries and that we are using a lot of protective equipment for the elective surgeries. And it concerns me greatly that we're going to use up a lot of our N95s and other protective equipment on those surgeries. And that's going to leave those of us that are on the COVID positive units having to switch back over to surgical masks or lesser protection. On my unit, we have we have like little pods. Imagine the size of your living room. And then imagine there's 9 patient rooms lined up against the walls of your living room. We would be double occupancy in those rooms, and we've been denied negative airflow. So we don't have enhanced airflow on our unit. We would be basically packed in there like sardines, and we were being told that an N95 respirator is not necessary for confirmed COVID positive patients. People that are not in healthcare are thinking about the situations where you have a patient that is a paraplegic, a quadriplegic, the patient that's had a stroke, the patient that is, it takes 2 or 3 people to help turn them and clean them up. And COVID can cause diarrhea. And then some of our patients too are incontinent. And you're turning them, you're physical with these patients, you're close with them, up close and personal, and you're cleaning them, you're wiping them, you're turning them. You're in very close proximity to these patients who are coughing, who are on oxygen. If at all possible, we need state guidance, because I don't think facilities are just kind of doing the bottom line right now, just trying to save money.